Hey guys, Dr. Clayton Roach here from Adjusting Attitudes. And here's my question for today. If your office did not acquire one more new patient from tomorrow, no more new patients, how long would your practice survive? Think about it. No more new patients. How long does your practice survive? So what am I really asking you? How many wellness patients do you have in your practice right now? Is your practice dependent on having more new patients all the time just to replace the ones that are leaving? If that's you, you have a problem on your hands, because if your marketing fails, you go on vacation, you might be one of those people that goes on vacation and panics, not knowing how his practice is going to do when you come back, knowing that you're going to have to boost marketing as soon as you come back because you left for a week. Seriously? A week out of 365 days, your practice dives because of that? Those are all signs of a practice that's unstable. So you are supposed to be, as a chiropractor, developing this wellness base, this base of wellness patients, this tribe that is following you every time, every year. They keep coming every month, every second week, because you've educated them properly to know that chiropractic is not a pill. It's not it's a way of life. And they're going to do that just like they're going to their dentist and they're brushing their teeth and they're exercising. So if your practice didn't see one more new patients from here on in, how long will it last? What system do you have in place to properly educate and keep your patients? Retain them. Because every effort that you're putting into getting new patients, think about that effort. It's a much greater effort to attract new ones than to maintain and retain the ones that you already have. It's also much cheaper. So with Adjusting Attitudes, and if you haven't heard about Adjusting Attitudes, it's totally revolutionizing, and patients are loving it. My clients are loving it because they have now a passive system that educates on a regular basis your patients about chiropractic care and other general health concepts. It's an automated patient education system that not only educates your patients, but deals with the emotions that they're having at a particular time in your practice during their care. So for example, they might be at your report of findings and they have these emotions that you don't know exist. And if you fail to connect with those emotions and address those emotions, they might be saying yes to you at the report of findings, and they go home, they talk to their husband, and then they call the next day to cancel all the appointments that you basically pre-booked at the time of the report of findings, and they're deciding not to start care. I'm sure it's happened to you before. So why is that? So you need to have a passive education system that, regardless if you go away, regardless if you have an associate take your place, regardless if you're busy and you don't have time for your tick around the table, if you're running behind, you want to have a system that ensures that your patients are getting the education that they need and they deserve. With the education that they're supposed to have, you're more likely to retain that patient for life. And sometimes we fall short in the practice, which is why we need a system outside the practice. So Adjusting Attitudes is just that. And I created Adjusting Attitudes kind of in a selfish way because I wanted it for my practice. And nobody had this type of a system in the profession. We're always talking about new patients, new patients, new patients, but nobody's ever talking about retention and has a proven system, scientifically based on over 1,200 interviews that I did with my patients. Nobody has that. So this is why you need to check out Adjusting Attitudes if you haven't already. We just released Adjusting Attitudes 2.0, which has, there was a few bugs that we fixed. We added a few things. It's unbelievable. You need to check it out. If you haven't opted in yet to our free training program, do that. It'll kind of give you an overall idea as to what it's based on. And if you feel compelled to do so, you can sign up for our Adjusting Attitudes system. I look forward to hearing you. Any comments, any questions you have, feel free to email me, send me comments. I'll email you and write you back as soon as I can, which is usually within 24 hours. Adjusting Attitudes, a new wave in patient education. We've been telling the story for a long time. We're told to say it louder, yet our PVA, our patient visit average in North America is 10 to 15, so we're failing miserably at keeping our patients. Take care. Have a great time. Talk to you soon.